Hi, my name is Cindy Martinez. I am the current Dean for the School of Community Medicine. I am pleased to be here right now to share a little bit more about the Master of Science in Community Medicine. A little bit about me. I was a bio pre-med major. First in my family to go to college. I had huge aspirations to go on to med school, but unfortunately, due to my family's financial situation, as well as not really being aware of what higher education was, and don't get me wrong, they were huge proponents of higher education. But given that none of my other siblings went off to college, they told me at a very young age that if I wanted to go to college, I had to pay for it. So when I was in high school, I dreamed to go to the University of Southern California. In LA, being a local native, from LA, that was the school that most of us all aspired to. But my family said nope, and being a very traditional Hispanic family, they said nope, you can't leave the house until you get married. Your only options are Cal Poly Pomona or Cal State Fullerton. So there I go, waitressing while I'm in high school, 40 hours a week to save all of my tip money, ones and fives, to go to college. I pay for my first quarter tuition at Cal Poly. I get really involved in mentorship programs. I get really involved in all of the pre-med clubs that were on campus, and I start volunteering at City of Hope. And that really was an eye-opening experience to me. It was such a positive experience, and that's where I truly thrived in providing resources to patients once they got diagnosed with cancer. Since working so much in undergrad and literally paying for my tuition in ones and fives, that when it came down to studying for the MCAT, I couldn't. I just struggled. So I just started working at City of Hope. I worked in the health education office, and I continued to provide resources to now patients, families, and caregivers. And it was life-changing moment when a physician came up to me and just said, Cindy, what are you doing? You graduated from your undergrad. I know you want to go on to med school. Like, what's next? That famous question of what's next. And I said, I can't even afford to take the MCAT. I can't even think about going to med school. And he said, you should go talk to my wife. She works at the University of Southern California. I'm like, what? Like, this is my dream school. And long story short, I ended up going to USC to pursue a master's degree as my gap year until I decide what I want to do as far as medical school. That was a life-changing moment for me, where I realized how much I valued education and how much I wanted to become a lifelong learner. And although I didn't choose to go on to medical school, I loved my education that I was getting at USC. I continued to work in higher education. I was advising first-generation college students across different disciplines, from the School of Social Work to the Marshall School of Business to the Annenberg School for Communication and Journalism. I spent over 20 years working in higher education. Everything came together. It all fell together. When they always say, do what you're passionate about and it'll all fall together. And that's exactly what happened. I started in a very low program assistant position, moved up to a director within 5 years, had amazing mentors along the way that told me that I should go on to higher education and consider a doctorate degree. And I'm like, what is a doctorate? Like, no one told me about a doctorate. In my mind, it was I was going to be an MD, not even get a PhD. So I started doing a lot of informational interviews, and that's what led me to pursue a PhD. I started teaching at USC. I continued to advise and mentor first-generation college students. Had 2 children along the way, and once my kids now were applying for colleges, call it brainwashing, but guess where they wanted to go? USC, and my daughter got admitted to the school that I was working at, and that's when I said, okay, my life now, I got my kids exactly where they want to be, or where I want them to be. And I said, what is it really that I want to do? And that's when I said, you know what, my passion has always been in the sciences. The bio in me never went away. I was really involved in mentoring students who were pursuing STEM careers as well. And I said, this is where I really want to end my career. So I started researching what schools would I really feel that I can make the biggest difference. And that's how I found KGI. KGI is such a special place where it really takes a special student to find KGI. It's someone who is very innovative, somebody who wants to change the world for better. And that's really where I saw there was the most alignment between my personal values and what my organizational values. And that's where I said I wanted to end my career at. And so I found KGI. I started as the Dean of Students, where I was able to meet and work with students across all disciplines. I served in that role for almost 4 years, and that's where I learned about the Master of Science in Community Medicine. I worked really closely with the founding dean, Dr. David Lawrence, and I could not believe that he was putting together a master's program that was designed to help underrepresented, underserved students work in their communities and either go on to be physicians, dentists, PAs, anything within the health professions, or work directly into the community that they want to serve. I was so impressed with this program. I worked really closely with him. I got really close to the first cohort of students to really understand, what was their motivation for finding the MSCM degree. And that's where I said, this is really the place that I would want to work. I would really want to continue to serve these students who are really trying to make a difference in the health disparities, improve the inequalities that we're seeing within healthcare. And I said, how great is this to be in a place where I can combine both my passions for both education and healthcare. So when the position presented itself for the dean was retiring, I definitely, had a lot of meetings with the founding, former dean, Dr. David Lawrence, and asked him, is this just a wild, crazy idea for me to apply for this position? And he said, we're trying to train those students to find those communities that look just like them, because that's how you build trust in these communities. And he said, I can't think of a better person that would be able to build, the trust in the communities is someone that looks like them, that has an amazing story of you've come full circle, to where you're now being able to educate and guide and mentor those students who are doing and overcome those hurdles that you had done. And that's where I just feel like I am in my place in my career, is where it's now my time to pay it forward. Mentorship has consistently been a common thread in my story. And that's what I really hope to continue to do, leading the MSCM program, is making sure that I'm providing students with the resources, connecting them to amazing mentors to help them be successful, and so that they can get to where they ultimately want to be, whether it's in their own community or going to med school.